Hi, I am Ashwini Murthy, intensivist and head of medical services at Avanta Healthcare Private Limited. I'll say briefly a few things about pulmonary rehabilitation or respiratory rehabilitation. Now, pulmonary rehabilitation is the use of supervised exercise, education, support, and behavioral intervention to improve how people with chronic lung disease can function in daily life and to enhance their quality of life. It is designed for people with chronic lung disease with the primary goal to enable them to achieve and maintain their maximum level of independence and functioning. Who would require pulmonary rehabilitation? Anyone with a chronic lung condition like asthma, bronchiectasis, COPD, COVID-19, cystic fibrosis, interstitial lung disease, lung cancer, neuromuscular disorders, pulmonary hypertension, sarcoidosis, and also for patients who have stayed for a long time in the ICU, have been on a ventilator for a long time, and who have had a tracheostomy. Now, this will improve pulmonary rehabilitation programs, will improve the quality of life by reducing the shortness of breath, increasing exercise tolerance, promoting a sense of well-being, and decreasing the number of hospitalizations. So, pulmonary rehabilitation will both before and after surgery benefit patients who have been or will be operated for lung cancer. Patients with COPD particularly will benefit from pulmonary rehabilitation programs because as time goes, their lung capacity reduces. So, with the help of a specific set of interventions, we will be to some extent able to improve their lung capacity. Patients who have to undergo lung transplant for any reason would definitely benefit from pulmonary rehabilitation. It can be conducted in an outpatient setting or even at a person's home. Now, these pulmonary rehabilitation programs will be particularly helpful if they are implemented before the disease becomes severe. Even with patients with minimal or mild disease can benefit, in fact will benefit from this therapy by reducing their shortness of breath and increasing their exercise tolerance. Many times pulmonary and cardiac rehabilitations are actually combined because most of them will be coexisting diseases. Pulmonary rehabilitation is best conducted by respiratory therapists or physiotherapists in addition to a team of a dietitian, nurses, doctors, social workers, and a team of even a psychologist for that matter to help them overcome the depression or anxiety that is caused by such chronic diseases. Now, particularly for patients who have stayed in an ICU for a significant length of time, who have been on a ventilator for a long time, who have had a tracheostomy, and in patients in whom there is difficulty in weaning from the ventilator, pulmonary or respiratory rehabilitation becomes of paramount importance and is particularly helpful in getting them off the ventilator and to a reasonable degree of quality of life and independence. So, overall, pulmonary rehabilitation forms an important part in patients who have had a prolonged ICU stay on a ventilator. So, in addition to all this set of interventions, as with any other condition, particularly cardiac and pulmonary, lifestyle modifications become very important. So, education and counseling, particularly to quit smoking, goes a long way in helping patients with chronic respiratory conditions. Thank you.